degree in zoology from Walla Walla University in 1965. The Doctor of Medicine from Loma Linda University in 1969, and a Master of Public Health in Biostatistics and Epidemiology in 1944 from Loma Linda University. He is board certified in general surgery since 1974. He is also an associate professor at both the School of Medicine and the School of Public Health, Loma Linda University. Currently, he is the director of the Obesity Research and Nutrition Research Center, Loma Linda University. He has received many awards and honors from professional societies, namely the American Medical Association, the American College of Preventive Medicine, the Obesity Society, the Obesity Medical Association, and so on. Dr. Peter has done numerous researches on weight control, management, and obesity, and published many scientific and medical articles on the same subject. Dr. Peter's passion for the investigation of the biology of the disease of obesity began with the death of his own father from obesity when he was only 54 years old and when Dr. Peters was graduating from medical school. Since then, he used his surgical preventive medicine and research skills to address the disease epidemic. To present to all of you, Dr. Peter's credential will take me at least half an hour, and that will take up all the time of his presentation. So, Dr. Peters, thank you for spending your Sabbath afternoon with us, and we also welcome his wife, Jeannie. The time is yours, Doctor.
Well, thank you very much for that kindness. And Jeannie and I want to thank you because of your hospitality at this lovely church. So as we ate with you, eating is how we get acquainted, isn't it? And it also makes us one. So no matter what our thoughts, what our beliefs, we are always one. I always refer to us in my work schedule. When we make a mistake, I just go, well, we're only Homo sapiens. So it's just the way we are. And we actually are fairly primitive because we haven't learned that shooting each other doesn't really solve any problems. Isn't that amazing? I mean, you'd think if we'd look back over historical time, shooting each other, I mean, when I swim laps at the Drayson Center with David here, I want to be a porpoise because they're way ahead of us. You know, they've already figured out that shooting each other probably doesn't make any sense, and they just talk to each other and have a good time. So we're kind of the primitive folks. We still shoot each other. So hopefully, and the message today would bring us to that point where killing one another does not at all solve problems. So in the interest of saving paper, if there's anything on the screen that you want to save, feel free to just use your phones and just take a picture of the picture. And because we will be referring to several kind of specific areas. And I'm glad to see we have young people here because Alzheimer's disease, we always think of that as being something that old people get. But whether you do get it or don't get it actually starts in your 30s, 40s, and 50s. So it's a really amazing. The lifestyle at 30, 40, and 50 makes more difference than the lifestyle in our 70s and 80s. So if you're 70 and 80, well, whatever, have an extra cookie. But it's the 30s and 40s and 50s that actually sets us up for this disease. Now, we're going to be talking about some kind of specific things. And, we're kind of used to talking about heart disease. Oh, yeah, people are going to have heart disease, and they can fix it. They put a little stent in, and I'm going to be okay. Or can replace a valve. And, we're kind of accustomed to talking about cancer. Like, oh, yeah, cancer, yeah, we'll just cut it out. And, boy, I know somebody, and they lived 20 years after they had cancer. But Alzheimer's disease is really, really scary. And we haven't gotten accustomed to talking about it. So that's why I want to kind of leave this open for kind of a beginning of a conversation in realizing that, believe it or not, there are things that we can do. So one of my primary areas is in preventive medicine. So when my surgeons refer to me, they call me a recovering surgeon because I just do preventive medicine. And in this area, I'm just full-time research now at Loma Linda. So it's those of you that are getting older, research is a really cool thing. Jeannie will tell you, I don't get up until 7 now. It used to be 5:30. If I get to the office by 9 or 10, that's really cool. And all I do is a lot of traveling. I go to all kinds of meetings and learn what I can. But I hang out with the industry of pharmaceuticals. And then we bring studies back to Loma Linda. We bring ideas back to Loma Linda. And so I'm going to be sharing some of the ideas that we're now working on at Loma Linda in this area of dementia. And the reason why they're connected, you heard the story about obesity, which is highly connected to diabetes. When we cure obesity, diabetes goes away. And then the diabetes is actually part of what's happening inside of our brain, as we'll hear as we go into dementia. So it's kind of an insulin resistance, and we'll kind of be talking about some of that. We're a small group, and we have time. So if something is totally not understandable, just raise your hand. And we're a small enough group here. If you just shout it out, just say whatever the question is. And I'm on the spectrum of attention deficit, so I can go out this way and go out that way and come back. So it's not really terribly hard. So you won't be interrupting me in any way. So, this is kind of good, this prompter. I thought if I could wear my driving glasses, I could actually read, but I actually can't quite. But, this may be a bit challenging. Let me just come down just a little bit closer to where you are, and because I am going to have to work off where is the teleprompter? Oh, yeah, here, this is a good one. Thank you. So anyway, right with you. So actually, how common is this, So when you think about, just going from over age 45, 1 in 5 women, so that's a very high incidence. And then we go to, and 1 in 10 for men in our African American community, it's actually twice as high. And in our Hispanic community, it's about 150% increased risk. So we're really focusing on this. Now notice when we drop to older age, at age 85, it's 1 in 3, and men and women are the same. So you can see there's a little early preponderance of women in those earlier ages, but by the time we get to 85, it's about the same. Now, there's one gene that is of interest, and this one is called APO4. Now, as you remember the helix, remember the double helix. So in the genetic world, your DNA is like 4-4, 2-4, 3-4. There's always 2 numbers. So if you have an APOE and it's 2.2, you're actually protected. So you probably will never get Alzheimer's. Now, if you have one copy, so 25% of us carry one copy of 4, so it would be a 4.3 or a 4.2 or a 4.4, but that one copy, we carry it, and it 2 to 3 times increase the risk of dementia. Then 2 to 3% of us carry 2 copies. That's the 4.4. That's the bad one. So and we're going to be talking about how you can check what you are, and you'll start seeing where we're headed with that. So then worldwide, about 10 million new cases every year. And sadly, 60% of these are actually found in lower and middle income countries. So I just came back from Toronto to the annual Alzheimer's Convention International, and we're really looking at the lower half of our world. So we had representatives from Africa and from the southern countries, because 60% of our dementia is showing up. And that's largely or partly because that lower half is beginning to adopt the Western lifestyle and be exposed to the same things that we're exposed here. So the question kind of comes up, why are more women than men affected with Alzheimer's? That's our perception. But I want to show you kind of carefully why we talk about epidemiology. We want to look at the entire data. And so when we look at any one time in America, 2/3 of the people with Alzheimer's disease are women. So that sounds really bad. But when you actually look at when we age match, then we find that there is no difference. And men just die sooner. And so, therefore, the people that survive just happen to be women. And oh, by the way, they're getting older, and age is the biggest risk factor of Alzheimer's. Wouldn't you like to change that age? This is a sub-running culture that you probably aren't exposed to, but I live in this subculture, and longevity is just going gangbuster. Trillions of dollars are going into how to help people be healthy for a much, much, much longer time. And when you think about God creating us, God didn't make junk. You know, why don't we live to be 200? You know, what's our problem? See? So there's a lot going on, so stay tuned, because trillions of dollars are going into understanding and therefore extending the life. One of the more extreme people in this movement says that today, the first person to live to 200 has been born. So stay tuned, as they say. Anyway, so once we actually age stratify, so we take 75, 75, 85, 85, 95, 95, we find that there is no difference between men and women. The prevalence looks bad because men just die sooner. And, you know, we send them into military, we stand them up and we shoot them, and they all like to go around bars and shoot each other. And you notice that women don't do mass shootings very often. So the boys, they kind of have maybe too much testosterone or something. So women seem to accumulate this. There's this little tau. This tau is a tangle that's inside of our brain. And women do seem to accumulate that faster, and that is tied specifically to memory. Now, since we're talking about memory, be very cautious what you hear and how you interpret it. Because just because you went out to the garage and you forgot why you went out to the garage doesn't mean that you have dementia. But if you put your phone in the microwave that's bad. So if you lose your keys, not to worry. If you put your phone in the microwave, then we should start worrying a little bit about that. So the early hormone replacement, because often there's a question if hormones are replaced, could that be positive? And the evidence would say that early hormone replacement is good. And I'm a very pro-hormone person, and so you kind of, you want to take that with a little grain of salt. But now, by contrast, if we start doing late hormone replacement, so this is like 10 years after menopause, and then somebody says, oh, well, I want to get younger, I think I'll use some hormones. That's not a good idea. But early hormone replacement is actually quite valuable. I might put a little stroke out there because you may have heard that hormones cause breast cancer and so on. In the Women's Health Initiative, one of the largest studies that's ever been done with women, at 10 years, at 20 years, there was no difference in all-cause mortality between hormone replacement and non-hormone replacement. The Women's Health Initiative. Yes, ma'am.
So if they did hormone replacement early, is there a point in time when they should stop doing it?
That's a very good point. It's very controversial right now because based on the Women's Health Study, it said that if you start hormone replacement early, you probably should just kind of continue it for the rest of your life. But nowadays, there's a little back and forth because there's some evidence that there may be an increase in breast cancer. So now they're using this little 10-year story. But I'm very skeptical about some of that. And so particularly the hormone progesterone, we want to make sure, just think of you women that were pregnant. When did you feel your healthiest? Pregnant. And of course that placenta was just pouring out progesterone. Your brain worked, everything, you were on the top of the world. So anyway, it is controversial, but good question. Yeah. Okay, so the take home, midlife, avoidance of obesity, maintain physical exercise, avoid microprocessed foods, social interactions. So we'll be emphasizing some of these things again. So then we come kind of to our targets of prevention. So where can we start working? So there's two areas in our brain that were worrisome. You know how you have plaques in your arteries and that causes heart attacks? Well, in your brain, plaques begin an inflammatory process that then creates tangles. So we have these two areas. We have the amyloid plaque, and then we have the tau tangles. So those are going to be our focus. Those are going to be where we're going to be heading. So in a prevention world, what do we do? So the first thing is obviously to avoid toxins. And I was studying Alzheimer's, and I was having vodka for breakfast. That really didn't make much sense, did it? So don't use alcohol, because it's not good for the brain. Cigarettes, obviously. Plastics, we're going to talk a little more about in just a moment. Any of the additives, and then the sweeteners, the flavor enhancers. For you dear vegetarians, check your meat substitute labels very, very carefully, because to make those fakey foods taste like something that's edible, you're going to find some nasty little enhancers there that you may not want to have. So the hydrolyzed soy protein is an example. So vascular health is very, very important, particularly in this plaque area. And this is where we see small strokes. So this is more a vascular dementia, not AD, but a vascular dementia, where there's little white specks that you'll see showing up on the brain MRI. So we're going to be spending quite a bit of time glucose for the brain. This is the metabolic syndrome. And one of the multiple pathways that lead to dementia, insulin resistance, is a big, big deal. And that's where my research comes in because of using the medications to treat obesity and diabetes. So inflammation, a major contributor to dementia. And we have a new pharmaceutical that's coming in from Novo Nordisk that is, we have something called cytokines, which is an inflammatory marker. One of those is called IL-6. So this IL-6 decreases, this medication decreases the IL-6. And so I kid my pharmaceutical friends that if we can cure obesity and we can cure inflammation, 70% of the diseases will disappear and they'll be out of work because we won't need all those drugs. So, and then the microbiome is increasingly important. You know, if you want to always blame something that happens to you on somebody else, just blame it on your gut bugs, because there are more gut bugs, cells, and DNA than us. There is more DNA from our gut bugs than we have ourselves. So it's like, who's running the show here? Are we just a host for the gut bug community? And we'll be showing you a few more details on that in just a moment. So with that, we're going to turn to a little bit about plastics. And I have my steel water bottle up here. I wanted to demonstrate that we probably should be leaning away from plastics as much as possible. So autopsy reports in 2025, frontal brain tissue autopsies, this is how much plastic they actually found per gram. So 4,800 micrograms per gram of brain tissue, 50% increase since 2016, higher in the brain than even the liver. And of course, the liver and the kidney screen all of our blood, and to find our brain with more plastic so it's primarily the polyethylene. So this is the water bottles, air, particularly like the water bottles that have been out in the heat. And you think of our military, you know, all they have is water bottles, plastic water bottles that have been in the deserts and heat and so on. And the cars, the heated foods, currently we don't have a method of removal. And actually today we have the equivalent of a plastic spoon in our brain. It's the nanoparticles, the little nanoparticles. Obviously you don't have a spoon that big in your brain, but it's the little nanoplastics that are everywhere. And so prevention, drink water out of glass and stainless, reverse osmosis, avoid heating foods in plastic container, limit single-use plastic food containers, and wear natural fibers. So as much as possible, and of course it's not going to kill you if if somebody offered us a drink out of a plastic bottle, just drink it, it's no big deal. But over time, move away. Some of the very hard plastics, so if you're trying to find a lightweight, some of the very hard plastics, you can look it up, they do not shed plastics like the soft polyethylene does. So as we come down, we're kind of taking a little journey into lifestyle. Everybody in this Seventh-day Adventist world, we all love to talk about food, and I was so delighted. Did you see our buffet today? I mean, my word, weren't there vegetables everywhere? I mean, it's like, it's the obvious. Just do what Grandma said. Eat your vegetables, I mean, this is not rocket science. I mean, everybody knows this, but do we do it? And then go easy on the high glycemic load fruits. I could tell when my patients, when they came from the Philippines or they were Asian, because all of a sudden their A1Cs would just skyrocket during papaya season because they'd eat a whole case of papayas, just in 1 week. And so go easy on the high glycemic load. Choose the berries and hard fruits. Plenty of natural fats, full fats. Do not eat anything that says low fat. Fat is good for us. Fat was made to satisfy. This whole low fat thing was created by the food industry. Fat is not addicting, sugar is. When you eat fat, you eat less. And of course, that doesn't bring in the big dollars. And about 3 mega companies control 90% of our food in the US right now. And it's all about making money, has nothing to do with health. And under our current administration, we're deregulating everything. So it's just, if it makes money, sell it. If it's going to kill people, no worries. You know, it's what is the profit margin for my trillionaires today. So that's the current way we're headed. So watch it very carefully. Consider some time-restricted eating. This apoptosis is the way that the body kind of cleans up itself. And it's very, very efficient. We call it apoptosis. That means it eats itself. So let's just say that there's a tired little cell bonging around, and it's really not doing a really good job. It actually, if it just sits there, it can start making some inflammatory changes that are not good for us. But when we fast, we will actually eat, destroy, and consume that we'll recycle that poor little cell. And apoptosis is a very, very good. So one of the easy ways, many of us just eat breakfast, and then we eat a late lunch. And then we don't eat until the next breakfast. And so it's a little time restricted. You could do it the other way. You could, if you're not interested in breakfast, just have lunch and then eat an early supper or dinner. And so what we're trying to get is like 12, 18 hours when our body just can rest, and the body, we stress it just a bit. So the body goes out and goes, oh, here's a poor little old cell. It's not doing much. I think it'll give us some energy. I'll just eat it. So it recycles. And that really, really helps in this prevention process. Oh, liquids, for sure. Big time liquids, yeah. If you urinate and it's yellow, you're not drinking enough water. You gotta drink enough water until it looks like water when you pee it out. That's a big one, isn't it? Particularly for us men that have big prostates, and it gets to be a big challenge. So consider that time restricted. So clicker. There we go. So I need to put a little spoiler alert here because I'm going to be talking about fish. So this may be a little biased because I paid for college and medical school by commercial salmon fishing in southeastern Alaska, and even Jeannie came and fished one season with us while she was doing her boards for nursing. But she only came for 1 year, so that may tell you something about the fishing industry. So Alzheimer's disease is associated with a higher inflammatory markers. Here's our cytokines, IL-2, 6, 8, tumor necrosis factors. So this is kind of one of our targets, is these inflammatory areas. Eating fish several days a week is associated with a decrease in these markers. So at Loma Linda, I have to refer to this as the Jesus diet. So a little fish, because there's this veganism, and I don't know, you probably have some good vegans here as well, and so the ism there, but this is the Jesus diet. So fish may be one of the biggest studies in the treatment of Alzheimer's that I was just exposed to just a few months ago in Toronto. Comes from the Finnish, and of course the Finnish have a 10-year program to treat mild cognitive impairment and dementia with lifestyle. And of course the lifestyle is fish. And they've done some of the most amazing work on actually slowing the process of dementia. Yes, ma'am.
Dr. Warren, aren't there also certain fishes we should eat more of and certain that we avoid because of the microplastics and such?
You got that right. And it's getting good fish. Boy, I should have put this on a slide. Getting good fish is increasingly difficult. So where we try to do is we try to find naturally caught fish, not farmed fish. And we try to go up into the North Atlantic, So that would be Denmark and Finland and those areas there. And where Jeannie and I get our fish is we actually get them from Bristol Bay in Alaska, and the fishermen themselves, they catch the fish, they fillet the fish, they flash freeze the fish, and they deliver it to our doorstep in Redlands every 1 to 2 months. And and I should have put it up on a slide here, but if you want to know, it's called Wild Alaskan Company. So notice there's no fish world there. Wild Alaskan Company, and just a little more pricey than Costco. Costco does have some, fresh caught fish as well, but this way it came right out of the ocean, and it went right into. It was immediately filleted. It was immediately flash frozen, and it immediately comes to your house. Yes, ma'am. It has some mercury content, and even the wild caught. But the further away we can get from, where the mercury's coming from, which I wouldn't want to go Baltimore, Chesapeake Bay, But there is a little bit of mercury there, so it is part of the deal. And it's kind of like there's nothing pure, but what's the lesser and what's the greater? Where's the weight of evidence? So, and so this is where everybody says, well, I'll just take an omega-3 pill. And for our vegetarian friends, the plant-based omega-3s do not have the DHA that's needed. So the seed sources, the algae source might be better, but the fish itself. So here is actually a comparison, and these are, when you see RCT, that means randomized controlled trial. So this is not just an observation. This is actually a randomized controlled trial where some people get placebo, some people get active. And so you'll see here that EPA delivered. So if you eat the fish, you get about 400 to 700. If you take a supplement, you get the EPA and the DHA. And then the comparators, low, no fish intake, and then the placebo oils. But notice down here that the cognitive benefits, observational, consistent, lower dementia, 1 to 2 servings per week. When you go over here to the supplements, it's not so clear. So sometimes it says, yes, it's helpful. Sometimes it says it doesn't. So eating the fish, because the fish not only has the omega-3s, it has selenium, vitamin D, iodine, it has the protein, and pays special attention to taurine. Taurine, if you look that up, is amazingly beneficial, and it only comes from animal sources. So anyway, that's the Jesus diet. So when we think of our gut biome, it really is quite pivotal. So many conditions. So you can take heart disease, you can take cancers, you can take all inflammatory, autosomal diseases, all kinds of things. And it's our gut bugs. More and more, I'd actually check my oral gut bugs, my bowel gut bugs, and they're very useful. And I could tell you stories for the rest of the afternoon on just gut bugs. But inflammatory reduction, these are the short-chain fatty acids, L-butyrate. The gut bugs produce this, and they're anti-inflammatory. They also produce the serotonin and dopamine. So serotonin and dopamine are kind of what makes us feel good. So dopamine is more our happiness is in a balanced way. And it actually, when you kind of say, well, how does it get to my brain? So it goes into the vagus nerve, which comes up to our, so we have the gut-brain connection, and it goes right on up to our brain through the vagus nerve. Now, you've probably heard the term leaky gut, and so this is important to kind of keep your GI tract intact. So when toxins like mercury come in, that the body can actually get rid of it. And so the leaky gut is a very important thing. The immune system modulation, enzymes, it actually produces, the gut bugs actually produce enzymes that alter the amyloid plaque formation. Pretty cool, huh? So shake hands with your gut bugs. Take good care of them. And so how do you get healthy gut bugs? Well, one of the ways to do this is you can take probiotics. You can get them from Amazon or a health food store or something. Fermented foods. I'm Polish, Russian, German, so I eat sauerkraut at my office every day, just on my salad. And if you don't like sauerkraut, kimchi, I don't know if you come from an Asian background, some kimchi is there. Kefir. Jeannie knows that I have kefir every morning because kefir is a longevity. It comes, and I use goat milk because goat milk is the healthiest milk that we have, because goats are just indestructible and they don't get diseases. And then pickled ginger and kombucha. So kombucha, I put a little kombucha in my smoothie in the morning. But Jeannie, you're not too much of a kombucha fan. So yeah, not everybody likes. And so if you don't like any of these foods, you better just take a pill. So anyway, and eat your, but you want the probiotics, so eat your fiber foods. So this is where you want lots of vegetables, lots of fiber. That helps. So then on the activity lifestyle, probably besides not getting old, exercise is the #1 prevention for Alzheimer's, the #1. And it's decreases this amyloid plaque. And the recommendation is about 150 minutes per week. So if you just kind of do the math, it's 20 to 30 minutes a day. And it can be anything. It doesn't have to be heart pounding, whatever. It can be weightlifting. It can be in the evening, I watch a little movie for 20 minutes and I'm on my little elliptical while I'm watching this stupid movie. And, at least I'm doing something that could be useful. And so a mixture of muscle and aerobic. So we really, really are emphasizing strength, because as we get older, we notice that we get more frail. And that's because the muscle mass goes down. And that's partly because we're not getting enough protein, and it's partly because we're not exercising enough to stimulate it. So this is really, and that's why we all hang out at the Drayson Center if we're close to Loma Linda, or here we got all kinds of 24-hour fitnesses. So this is the neuroplasticity. Exercise, we always kind of used to think that when you were born, you just had as many brain cells as you would ever get. But now we're finding that actually we can make new brain cells, and exercise stimulates these new brain cells. So raise your right hand. I will solemnly swear to get 20 minutes of exercise every day. So help me God. Amen. We are witnesses. All righty. Yes. Yeah, that's a very good question, as you heard there about the muscle structure. Muscle is muscle. So male or female, there's some, obviously differences, hormones and so on and so on. but the structure of the muscle cell is identical. So coming back to your observation, though, are women more active because they're household, but they're also CEOs sitting in desks like men do too. So I think that difference is probably we could ignore it now because men and women are doing about exactly the same things. But your point is very well taken that anything that's passive, and that's where they say sitting is the new smoking. And it's just as dangerous. So when I got new desks for my research clinic, I had every one of them kind of go up and down, and by cracky, I stand up for half the day at my desk. And so, but to your point, we've really got to get with it. So this is a factor that we're very, very excited about. We're doing some work in this area right now, the spiritual dimension. And what really is it? Where does it go? So I'd kind of fallen away from going to any kind of churches or anything. And then I was studying Alzheimer's, and they said you should hang out with a group. And I go, okay, better hang out with a group. So I joined a church, because there's a value, a very wide value. And we're trying to, I was just at a conference and actually was with a gentleman by the name of Harold Koenig, and he's from Duke University. He's probably the foremost researcher on spirituality and religiosity as it relates to health. His book is about $200 and about 3 inches thick. Just a compendium of it. So I had him look at one of our research studies that we're proposing. So, this is very, very complex in the spirituality world because, as we all know, there's good and there's bad in religions. Some religions can fill people with so much guilt that it just destroys their brains. And some other religions are so full of God that it's like, what's wrong with that? As I was explaining to somebody, if you're a child of God, can you be more a child of God? Can you be less a child of God? I think you just are a child of God. And so there's that positive that I'm hearing from your pulpit here. It's very, very beneficial. It's more than social interaction, but it's there with a purpose. Seeing the Pathfinders line up and learning to salute, that's putting people together in a group. And mindfulness, meditation, prayer, culture diversity brings spiritual diversity, awareness. And then, for goodness sakes, use common sense. If your spiritual area is working, keep doing it. If it isn't, stop. That's what we call deconstruction, reconstruction. If it isn't working, deconstruct it and find out why it's not working. And then reconstruct it into something that works for you. Everybody is different. God made us like snowflakes. So this one size fits everybody, it doesn't work in God's world. It's individual, precision medicine, consciously choosing to change. Lack of spiritual life is associated with higher levels of dementia in many observational studies. Take a brain shower. So we got to get sleep. So anybody here have trouble sleeping? Sleep is critical, and it's tough. And the older we get, the tougher it gets. And this is where the brain actually washes away some of the trash. And I just got a little headband, which doesn't work, but a little headband so I could actually monitor whether Jeannie was getting enough sleep, but I haven't been able to figure out the monitor yet. It stopped working. So that's a good intellectual challenge. But we have to get that sleep. And of course, some of you may have obstructive sleep apnea. And you may say, oh, I don't want to do CPAP. I don't want to do this. I don't want to do that. The good news is that the CPAPs are really, really getting better and easier to travel with. The second is there's even other mechanisms that are now available to us that have sleep apnea. And you don't have to be heavy to have sleep apnea, because as we get older, our tissues get a little flabbier and they fall back and we obstruct. So really look at that. And where is my clicker? There he goes. Yeah, so nocturia is tough for us guys. And I don't know why God decided to put that prostate right where you pee every day, because you only needed it the number of times you had children. All the stupid thing does is just float sperm. So it's like, why don't they just put a button or something? You know, I want a kid or something. Of course, women would want flop-down uteruses then too, because why do you have to bleed all the time just for the one time when you want to have a kid? So anyway, and any time that's more than 3 times per night that you have to get up to urinate, probably ought to check with a urologist. And I'm checking with my urologist this week, so it is a problem. Sleep hygiene, kind of for an hour, keep away from those screens. So just think of it as like a shower for your brain. So gamma frequency is an interesting, newer idea, and this is sound or light at 40 hertz. And this is a company out of Toronto. And animal models, they can actually show some regression of plaque. And where football players, or some very good football players with a lot of concussions do get dementia, we can reverse that dementia from concussion by using this gamma frequency. And we're doing a study right now, Dr. Colleen Brenner, I'm part of this study, where we're actually taking individuals with mild cognitive impairment. So this is pre-AD, so this is just mild cognitive impairment, and we're exposing them, in this case, to a sound, 40 hertz, and we'll have that published pretty soon. So now let's look at nutraceuticals. And so nutraceuticals are more than just a supplement to the diet. So when God created all of the botanicals in the world, it's an amazing, amazing, amazing how many of these botanicals have not even been tested. I mean, over and over, I'm seeing more and more of these coming out. And now that we have AI, we're actually using AI to rapidly test the nutraceutical properties in these herbs. So vitamin D, lower levels, predicts poor cognition. Folate, and depression, mood. Vitamin 12. This is really big. For any of you that choose to be vegans, and I want to save the earth also. So saving the earth is a good thing, but do take your B12. So the Adventist Health Study that's going to be published here in about the next 6 to 8 months. Vegans over the age of 85 have way more Alzheimer's than pescatarians. So you've got to, if you're going to be a vegan, you've got to supplement your B12 and probably your calcium as well. So there's a lot of controversy, and you can go back and forth. You could read whatever you want to read, but the facts are there. So zinc and copper, lower levels, are associated with depression. Ashwagandha, I love this herb. This is an Ayurvedic in the anxiety and insomnia. We've done one study with ashwagandha. Boswellia, we should just probably put it in the drinking water. I mean, this is a beautiful anti-inflammatory. It's frankincense. So the little story that I make up is that when the three kings came to honor Jesus Christ, and frankincense, it probably was the medicinal value, not the fragrance, that was so valuable. Boswellia, it works for racehorses. That's where I learned about it, because one of my patients took care of racehorses, and he said, when my racehorses get arthritis, I always give them Boswellia. And he said then all the horse handlers, they start taking the horses Boswellia. So, and I tried it out on my neighbor's dog. Ginger, commonly used, another Ayurvedic, 5,000 years. Pickled ginger increases the gut So kind of load up on that pickled ginger. Turmeric, everybody knows about, knows of, and it's just an amazing botanical. Blood thinners, maybe just a little bit of caution there, but may remove amyloid plaque. Resveratrol, this is the berries, grapes, chocolate, that sort of thing. And berberine is like metformin. And this is a longevity, so we're doing a longevity study in the country with metformin. So Jeannie and I go to Mexico and we get all our metformin, and we all want to take metformin, but we could take berberine just as easily. And some people can't take metformin, so remember berberine. So then we come to my favorite right this moment, and let's just talk about some everyday foods. So this is pomegranate, and we have a study right now we're applying because we've actually, one of our researchers, we call them preclinical, so these are people that work on mice, people that work with fruit flies, people that work with C. elegans, which is a worm, and we can do a lot of work with these little nematodes. But his studies actually showed that you could actually reverse amyloid plaque in the mouse using a pomegranate extract. And so the study then, here's beetroot, anti-inflammatory. But coming back to the pomegranate, the study we're looking towards is we've actually decided to go not the pomegranate extract, but urolithin A, and I'll have a slide on it in just a moment. Urolithin A is the better because about almost 50% of us do not have the right gut bugs to turn pomegranate into urolithin A, which is what works. So we might just go straight to it. Blueberries, mild cognitive impairment, showed improvement. Tomatoes, the lycopenes, and so here's our urolithin A, and so it's produced from the pomegranate, but requires the right gut bugs. So there's the gut bugs you want. I tried to find a supplement that could give us the gut bugs, but there is nobody making it yet. And so this is kind of, if you want to just do something, the urolithin A is a good thing. Just get it from Amazon. Don't pay a lot of money. So I was almost didn't put this slide in, but it was in the news, and I was afraid that some of you had seen about it. But it was a Harvard study with lithium, and I called it Small Doses, Big Questions. So this was the lithium levels in people with MCI were found to be significantly lower, and they tested 27 other metals. And lithium is a big deal. Lithium is used to treat bipolar psychiatric illnesses. So depletion in mouse models accelerates the plaque. When you supplement it, it restored memory in both AD and aged mice. So in aging humans, higher brain levels are associated with better working memory. The caution is that lithium has a very narrow therapeutic window. So you actually have to work with a doctor, get the lithium level measured, take the supplement. Maybe you're already just fine, but be very, very cautious about just going to Amazon and starting to take lithium. But I did want to put that slide in just primarily for the caution, because it was in the news about a week ago or so. So here's some of the older medical treatments. Aricept, some of you know it by that name. There's several of these cholinesterase inhibitors. Glutamate regulators, Namenda. So those have been around for probably 30, 40 years. Really not very effective. Maybe a 1 to 2 years of usefulness. So not very helpful. So now we're going to kind of move into what's currently out there, and you're hearing more and more about the monoclonal antibodies, and this is the big deal. And at Toronto, all the pharmaceuticals are getting into this market, and isn't this wonderful? And you'll notice here that one of them is 19,000 per year, the other is 32,000 per year. Oh, and by the way, they have side effects like brain bleeds, and you have to have PET scans, and they've given this nice little, they call it ARIA, so that's a code word for bad stuff that you can see. But what really, I guess, disturbs me is that when you actually look, so when you look at the PET scans, yes, the plaque was getting better. When you talk about was the patient getting better, you'll notice there, and I put that, you can see the change. There's a 0.45 up with lecanemab. Then you go down to donanemab, maybe a 35% change, and then this lecanemab, no benefit. So yes, plaque seems to be disappearing, but the patient doesn't actually do much better. So it's like millions and billions of dollars are going into this research. Now, a breakthrough that just came out in Toronto was this, there's a little glimmer of hope. And so this pharmaceutical company, this is Roche, and they actually came up with this little brain shuttle. And so the blood-brain barrier is a problem because you can't quite get anything into the brain, which is what saves our brain, so it's a good thing. But as far as trying to help the brain, it's hard to get in. So they got this little chaperone that actually takes the monoclonal into the brain, and this one may be a bigger benefit. So quickly, I'm going to end on the incretins. This is my world. And this is, you will know these by, you've heard of Ozempic for diabetes, you've heard of Wegovy for obesity, you've heard about Zepbound and Mounjaro. So these they help our insulin resistance. And they're called GLPs, you might have heard them by that. So this little schematic here just shows that it really gets hard to cross the blood-brain barrier, but it's attacking the metabolic disorder. This is the blood glucose problem. Here's their names. Incretin family. Trulicity is coming down. This could be a helpful one, crossing the blood-brain barrier. But this is the world I live in. And so we've got probably about 4 of these in the pipeline coming in that have not gotten FDA approval yet. And this is where we're wanting to do a research project. And this is a big study where we'll take people that have a marker for Alzheimer's but do not have symptoms. So as you'll see in a minute, we now have a blood test that can predict that a decade from now, you're going to have Alzheimer's. But we can do something during that decade. That's the good news. So the reason why this has to be philanthropy, because we're raising $1 million just to do this study. And I'll skip a kind of a bad story of why we have to use philanthropy. But the drug companies have turned us down 3 years in a row to actually prevent Alzheimer's that they're trying to treat. So I guess I'll go ahead and tell you that bad story. So that's why if you know anybody that really wants to dedicate to this kind of research, I'll give you my card. We'll call philanthropy at Loma Linda. It's tax deductible, but we're going to raise $1 million to do the study to definitively show that this group of medicines called incretins can prevent Alzheimer's, flat, dead on, prevent, because we can find it first, and I'll show you how we're going to find it. So before we go to the diagnosis, I want to put a little piece in here for the dear people that are actually taking care of people with mild cognitive impairment. This is a huge area. And Eli Lilly is actually funding some of the research we're planning to do is how to create a place where we can actually support people, the readiness, the palliative care, the patient readiness. This is where we have to have the family discussions. Yes, ma'am.
When you were referring to the blood test, how widespread is that within the doctors?
Yeah. My next slide will have that, and I'll really give you details on that. Yeah.
Just to let everybody know, we will need to pass the microphone around because we're recording live on YouTube and they cannot hear you when you use only your voice. So just heads up. Thank you.
Yeah. So she was wanting more information, which we'll come to on the. So this is very, very important to have this conversation with people that have mild cognitive impairment. You know, what is your long-term look? Because by the time we need to make decisions, we can't. And that's why we have to kind of make them ahead of time. So my family already knows my plan, that when I start finding that decline, I'm just not going to be here. And so, you know, you don't have to shoot yourself in the head or anything like that. But in California, we do have the benefit of having a celebrated death. We don't have to just go on and on and on. And so, but the trouble with in California here, this timely dying is flawed because it's primarily geared for people with cancer. So with the cancer, then somebody can say, well, you have 6 months to live, and then they can move in. And I've helped several of my patients actually pass on very, very gently. So pharmaceutically, we can do this. My patient had her favorite pizzas. She had her family all around her. She had her pastor with her. And she just took some medications that calmed her nicely. And then she took some medication that stopped her heart. And everybody was with her, and that was just it. And so in the Alzheimer's, it doesn't kill us. It just kills our brain. And so that's where some thinking has to go. So Jeannie had a story that came to her, was it probably secondhand or firsthand? Secondhand. And this dear woman, her parents all had Alzheimer's. She knew she's going to have Alzheimer's. And she gathered everybody together on a Thanksgiving. The family was there. They held her. And one of the ways that God intended for us to die is to go into renal failure. Just to go. Renal failure is so quiet, and why we poke IVs in people and try to hydrate them when the body's trying to pass on. And so this dear lady went without water for about 5-6 days, and she went into renal failure and passed. And this is not difficult. And 15 milligrams of digitalis that you can get from Mexico, it'll stop your heart. It's not a problem. So anyway, I just wanted to put that slide in here to let you know that avoid feeding tubes. Renal failure is quiet and peaceful. It's the way we were supposed to pass. So wasn't a big deal. So then we want to look at what laboratories. Now we're coming to the laboratory tests. So you'll want to take some pictures on this one. And to answer your question, this is now still difficult. So I just finally got my doctor to order mine. And of course, they weren't in the electronic medical record. So I've purposely put all the CPT codes and so on here on the screen. And when it's full, you can just take a picture of it, because you're going to have to knock, 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 squeak, squeak, if you really want to get it done. So, but it is now possible. So first of all, this was easy to get. So just get an insulin level. Everyone checks their A1Cs. You actually should be checking insulin. So insulin is up 5 to 10 years before the A1C goes up. So you want to see this early. We want insulin to be below 10. Many of the people in the preventive Alzheimer's world, like Dr. Bredesen, wants it below 5. Really, really low carby kind of world. So Then when you look at your cholesterol, you want to see there's the code. It's cardio IQ 92145. So in a moment, don't take a picture yet. I'll fill the screen up. And bigger particles are better. So you may think, oh, my cholesterol's really good. But when you look at the LD particles, if they're still small, they're very sticky and they're harmful. So then you never use the total cholesterol. So many of our vegan dear friends, they use total cholesterol, and on the vegan diet, your HDL drops so low that your total cholesterol goes down, but your ratio actually goes up. So you always want to have it less than 3.5. Triglycerides definitely below 100. Do not have any triglyceride higher than that. And now here's the plasma markers. So now let's see, let me do one more click. Nope, oops, let's go back one click. Let's go back because I want you to have this picture. Okay, so there's the codes. So there's 3 tests. So it's ApoE4, code is 12563. And then the p-tau 217 is a huge breakthrough. We first had that, it had to be spinal fluid. And it's just been in the last 2 years that we can do it with blood. So the p-tau 217 is a big one. And then the A-beta 4240 ratio 11786. Those 3 tests should, everybody that's over 65 should have that done. When you go to your doctor, when you go to particularly to Kaiser, they'll just think you're nuts and that you're just some cranky whoever. But just smile and go, well, thank you for your opinion. Could I talk to your superior? So you just keep going up, and then you finally say, look, will you just order it for me? I'll pay cash, and that's the way you can get it done. Yes, ma'am.
Okay. My mother had a memory loss in her older years, and the one thing, I'm a retired RN, that I seem to notice a lot with Alzheimer's was it's kind of a thing that if the patient has some dementia, they give that diagnosis, when sometimes that is not the case.
Exactly.
And so is there a way that they can absolutely say Alzheimer's or
Yes.
not?
Yes.
Because my mother, I think, had Lewy body dementia.
And Lewy body is one of our worst unsettled. But the p-tau will differentiate from Lewy body. And prefrontal is another nasty, nasty form of it. But the p-tau is now moved it to the point, this is almost like getting your cholesterol checked. Because you get it clocked because I want to avoid a heart attack 10 years from now. Now, this is what our Chinese friends are all over this. They're so far ahead of us here in America. They're actually doing retinal scans, and because they have a lot of people, and it costs a lot of money to do all these blood tests. So a retinal scan's very cheap, but you can diagnose whether it's moving because the eye is part of the brain. You can actually diagnose that that's going to be in the future. Then you can start doing all these prevention sort of things to avoid it, including the incretins. So my brother has Parkinson's. That's another one of the degenerative diseases. Jeannie goes to Mexico. I go to Mexico. We get him Rybelsus. And we got him off of it for a week or two. His memory just crashed. Put him back on, memory's back up again. So we have to force our way into this because the medical community is sloggy. And oh, by the way, particularly in the FMO type things, the less you do, the more money you make. So
Well, my doctor has said no to the blood test. So how much is it if I would pay?
yeah, I'll be able to tell you tomorrow. I think it's Thursday. I'm going to have my blood drawn, and my insurance will not pay for it either. So it is not a radically unusual test. So it may be higher. Let's just say it'll probably be under $1,000, and it probably is less than that. But as the as the commonness of it goes up, because we're using this in the research all the time, but on the clinical side, it's not there yet. But if you had to split it out, I would just get the p-tau 217, and that could be $300 or something like that. But I'm just guessing because I don't know. And even my bot didn't know. I asked my bot, and he couldn't figure it out either. So anyway, the question here.
Are you accepting test subjects?
We will be. So we have both the pomegranate, the urolithin study. The urolithin study is, we're going to go to the NIH. And of course, our current oligarchic government has defunded NIH radically. And so we hope that maybe a nutraceutical might apply to this gentleman that thinks that vitamin D might cure measles or something. But we're hoping that we could get that. The other one is philanthropy, and we're actively going to large retirement centers where wealthy people hang out, and we're trying to raise $1 million. So right now, no.
No. The Samueli family in Orange County, is pretty involved in the philanthropy, and also the wife in particular in natural approach, holistic.
I want to share my card with you, and then if you could get me connected.
I'll try.
Yeah.
I don't know the parents directly, but maybe through the daughter.
Sure.
Yeah.
No, it's philanthropy is a wonderful world. I work in that area. I just met with Ariana Huffington, raising money. So I'm comfortable in that space if you can get us connected. Yeah.
Do you recommend any supplements that middle-aged to older adults, I'm going to say middle-aged, I am middle-aged adult, to older adults can start taking now?
Sure. So I would say, first of all, just kind of look at that insulin level. So if your insulin level is higher, most of that you can contain from a dietary standpoint, doesn't require a supplement. So on the other hand, even at that age, I'd probably at least get the APOE gene because that's DNA, so that doesn't change. It's whatever you got, you got. So let's just say you did an APOE and you were a 2-2, I wouldn't supplement to avoid dementia. If you felt like you're not eating enough fish or you're not getting enough B12, probably B12 would be a really good supplement. But on the other hand, if you're an omnivoric Jesus diet kind of person, probably not a big worry. So, but when I see what was on the buffet today, just eat those vegetables. But no, I wouldn't recommend any.
We must have prepared for you to come.
Oh, that was a good day, huh?
I truly love what you said, but I also have to understand, from my perspective, my mother lived into her 90s. And let's say someone that's 95, 96, what benefit would that have starting at that point and using all the things that you're talking about?
That's a beautiful, beautiful question. And probably at 96, she's already proven to be a survivor. And so, doing any kind of radical supplements or doing this drug or that drug or something, I wouldn't touch it. But but a very good point. And another good point is even if my favorite story is there's a group of nuns that their unit, their covey or their whatever, they all give their brains for autopsy in the Alzheimer's world. This woman, when she passed, had one of the worst brains they'd ever seen. I mean, plaque everywhere, tangles everywhere. Oh, by the way, as she passed, she was learning her 6th language and was trying to understand astrophysics. So this anatomy that's there does not necessarily predict faulty brain function. So the brain is amazing, but the bulk of everybody, tangles and plaque are bad. But yeah, 96, God bless her. Yep, love her all you can. Yep. Here's a question back here.
What do you think about CBD oil?
Sure. The CBDs, you can ask Jeannie. She's so where Jeannie has, and she'd tell you this, so I'm not breaking confidence. But when you get older, you get a lot of arthritis, you get a lot of pain, and so we're trying a sublingual CBD THC combo for pain. And so far, she's found no benefit, but that's only 3 days worth. But CBD is very, very useful in the pain world and in other areas, particularly in the psychiatric. The THC can be very beneficial. We hope that this oligarchic government will de-escalate marijuana. It's classed as a morphine, so we can't even study it because it's opium, and excuse me. And peyote is another usual in Mexico, where my main clinical research coordinator has a ranch down in Mexico, and she was going to bring me some peyote because it just grows naturally. And they just scrape off a little bit of the root for pain. So there's a lot of these botanicals that could be but CBD is proven to be very valuable.
I know that there's some studies with Alzheimer's dementia patients, and they're testing CBD THC combos with the seniors. There was actually a guest speaker that we had sometime a year plus ago that was from a senior community center as a guest speaker for caregivers and how to manage, their mental health. And she actually has medical grade CBD, so it's high dosage, concentrated for seniors. And she actually gave me some for my dad, and he relaxed and he was feeling better. And that was after his first chemo round. So it was very beneficial for the chemo that he was dealing with. I know she uses it, she has it available for the seniors that go to her facility. So it is available. I just haven't seen so many studies quite yet. Sorry, Jeannie, were you about to say something?
Our friend Monica has really been using it on her knees and getting very good results.
And the osteoarthritis, topical. But I was not aware of that. I'll ask my bot to look for those studies because I haven't gone down that pathway. Thank you.
I was using CBD for my mom who had Parkinson's.
She had what?
Parkinson's.
Okay.
And it did help
very
with
good.
sleeping and just the anxiety. And of course, it increased her appetite.
Yes.
So that seemed to help.
So it must have had a little THC in it then for an appetite.
Well, I was using hemp oil. I was using the CBD oil, the drops, the tropical pills. Of course, I had to tell her it wasn't CBD because she has this idea that, that's not something to take. So I just told her it was candy or, oil, whatever worked. But it did increase her appetite too. No,
there's so many of these things that have been put on the skids. Even LSD was actually being used to treat alcoholism, and in Canada before it got put on the bad list. And so we're missing, because of all kinds of prejudice and all kinds of, it's the Mexicans and it's not truthful. So we should look for more. Yeah, look for more. All righty. Thank you all very much.
Thank you so much, Dr. Peters. This is a little unusual. We are not going to present a certificate of appreciation at his request. But instead of that, we all are going to say in harmony, thank you, Dr. Peter. Okay, 1, 2, 3. Thank you, Dr. Peters.
Whoa, that was way better
And then can we ask for both you guys to come forward?
Picture time, picture time. Jeannie, come please.
But I love the active questions.
After we take photos of our guests, then we're going to ask everybody that stayed for lecture to come forward so we can take a group photo.
Okay, before we do that, let me have a prayer. Okay. Our most gracious, loving Heavenly Father, we thank you so much for your Sabbath day. Thank you for your love. Especially, we thank you for all the message that we learned this morning during church service. And this afternoon, it's your health message. Help us to learn everything and apply into our daily life. We thank you for Dr. Peters and Jeannie, who spent time with us today to share his knowledge in Alzheimer. Help us to apply what we learned today and into our lives so that we will live longer to serve you until the day you come. In Jesus' name, amen.